Here in Nairobi, where clinical officers are currently staging a march to Afya House and Parliament as the medical workers' strike enters the second week. Our reporter Mark Namaso is covering this story for us and now joins us live with an update. Good afternoon, Namaso. Great to see you. Certainly not a good one from your end. But as you talk to us about what the clinical officers said earlier, where they had a press briefing, confirm if that peaceful procession to Afya House and Parliament has already started, Namaso.
Yeah, this is a combination of clinical officers and nurses. They initially congregated just down the road at Uhuru Park, and their goal was to head to Parliament as well as the Ministry of Health. Now, the seriousness of the matter cannot be more stated than a situation in which when you see the Ministry of Health workers or medics heading to their headquarters to strike outside the gates of their headquarters, the Ministry of Health, it tells you that matters are getting out of hand. And right now they are outside here just trying to draw attention and get their voices heard. Now let us join one of the officials of the medics union here in Nairobi to tell us exactly what they want to achieve by coming all the way up to the headquarters of the Ministry of Health. Kindly introduce yourself.
Thank you. My name is Tom Nyakaba. I am the branch secretary, Kenyan Clinical Officers Nairobi. And today, as you have seen, we have come here observing the COVID-19 rules and ensuring that our voices are heard. We have tried for the longest time possible to address these issues which have arisen without any level of jurisdiction. And today, we have decided that the employer must listen to us. And our employer is the Ministry of Health and the county governments. And what we are saying is this: they are not going to continue sitting comfortably in the boardrooms while our Kenyans are not getting the services they need. And this is what we are saying. The issues we are asking for are not weighty issues which cannot be sorted. Because the issues we want, like the issue of a comprehensive NHIF cover, how can we as healthcare workers of this country offer services which ourselves cannot afford? How can we as health workers of this country offer services and we are not sure of our health ourselves? What we are saying is this, and they must understand that as healthcare workers, we are also members of this earth. We know we have a calling, but this calling does not pay bills. And what we are saying is this: as they try to sort out the BBI issues, they must first and foremost sort out issues of healthcare workers in this country. We cannot continue talking of personal protective equipment 8 months down the line, because these are basic equipment we need to offer services in our facilities. How can we continue offering services and we don't have the basic needs to address our people? What we are saying is this, that they must, when COVID came, they employed a lot of staff under the UHC program. Unfortunately, most of these staff were employed under what we call the dubious contracts. And what we are saying is the government must employ these people to proper terms. And what we are saying is, when they are not on permanent and pensionable, they risk their lives and they lose a lot of benefits in the service. So the government must confirm them as permanent and pensionable and pay them, because most of them have not been paid for the last 6 months. And what we are saying, they must be paid fully and their terms change permanent and pensionable so that they enjoy and they don't continue risking their lives and that of their families.
Okay. We've had this issue of medics themselves. They are treating COVID-19 patients, they are exposing themselves, but when it comes to a situation in which they are infected, they are unable to cater for their own bills. How has this affected your morale at work?
Yes, thank you. Because this is the issue we are raising, that we are offering services which ourselves cannot afford. Number two, we cannot access the best of ICU facilities in this country because the government has not invested enough in our public health sector. We are forced to seek services outside where we work, and this now makes it very expensive for us. We don't have NHIF, we don't have another cover given by our respective employers. This has totally exposed us to this virus, and that's why we are saying enough is enough and we have to get a solution today.
Thank you for your time.
Thank you.
Now, for those who are joining us, we are just outside the Ministry of Health headquarters, which is known as Afya House. This is where we get the daily briefings on the COVID-19 tallies and numbers. And today, medics have decided that they are going to wait outside the gates of the Ministry of Health so that they hope that the government will this time hear their voice. Back to you.
The irony indeed, Namasa. But then again, before I let you go, just paint for us a picture of how the situation is in various hospitals, public hospitals, for instance, because this is now the second week, Namaswa. Clinical officers, nurses have downed their tools. I know we've covered this before, but just paint a picture for us of how the situation is.
Now, if you go to any health center, whether it is in town or in the grassroots, what we call in Kiswahili mashinani, you will find that most of the medics that we call doctor or daktari there are actually clinical officers. In Kenya, last time I checked, the number of medical doctors we have are about 7,200. Then we have clinical officers who number about 3 times that number. But we also have in the government, those ones who are employed by either the Ministry of Health directly, the national government, or those ones who are under the county government, they number about 8,000. So we have around 14,000 others who are in the private, have been employed by private enterprises. But if you look at the situation right now at the grassroots level, it is a situation in which most patients are being told to go back home or try to look for alternative places where they can be treated. So the situation is dire. We have clinical officers, we have nurses, and then doctors did not begin their strike at the same time as we have had clinical officers and nurses. Doctors decided to postpone their strike by about 2 weeks. So it tells you that in the next 1 week, things will be very tough, especially for people who are seeking for medication or healthcare services in public health facilities, because the clinical officers are not there, 1, nurses are not there, 2, and if the doctors decide to join the strike, now it will be a full-blown healthcare crisis in Kenya, and this happening in the middle of a pandemic will spell doom for a lot of people. We have seen lately clinical officers, doctors and nurses falling victim to COVID-19. They themselves are having a difficult time affording healthcare, which they themselves supply or provide the services to members of the public. We are already having fundraisers, medics themselves calling for fundraisers to help offset bills that have been accrued by members of their own profession. So it tells you the situation will be serious, especially for the common mwananchi who relies on public health facilities, because of course they are affordable and with the hope that they will get quality medical services. So the situation at the grassroots level is not very encouraging. And now looking at a situation in which we might be having doctors also join in the fray, then things will be very thick for the common mwananchi. Back to you.
Namasa, lastly, before I let you go, just allow me, I'm curious about the fact that the President Uhuru Kenyatta glozed over this issue during his Jamhuri Day speech. You know, he did talk about COVID-19 and the fight and the strides, the milestones that we've made, but he did not talk much about this health workers' strike. And again, it's the second week. Did these clinical officers and the nurses, perhaps the officials, mention anything or say anything about this?
Yes, the clinical officers and nurses have spoken about it. They have spoken of the loud silence of the president when he spoke during Jamhuri Day celebrations. He spoke extensively about BBI, development agenda, and many other issues, but he did not touch on the healthcare crisis. Now, according to the medics, if we look at the statistics of infections amongst members of this profession, of the medical field, you will notice that, they say that in the first COVID-19 wave, there were not very many cases of either infections or deaths amongst medics. But when you come to the second wave, things have not been that rosy. They claim that probably the government in the first instance of the first wave of COVID-19, we had government putting in place a lot of measures to ensure that the medics themselves do not get infected. Remember, they also had the risk allowance, in which lasted for about 3 months, in which nurses and clinical officers as well as lab technicians will get around 15,000 shillings per month, and medical doctors, pharmacists and dentists will get about 20,000 shillings. Now, that brings another bone of contention here, because after 3 months, the risk allowance was discontinued. And now the situation is compounded by the fact that medical officers who are employed under the Universal Health Coverage Scheme, some of them have not been paid, and it is running to 6 months. They have not received the salary. You remember the case of one medical doctor who died last week. He hadn't been paid for more than 5 months, even though his payslip was made public. But that tells you the situation in which you are a doctor, you haven't been paid for 6 months, all that stress of paying rent, housing, and providing medication for your own self, and then COVID-19 comes and summarizes your life. So it tells you the situation is not good, and the vibes, if we talk in street slang, it tells you that the level of morale is quite low. And today they hope that they will get they will get the government hearing them and their plight over these months that we are having COVID-19, and they themselves are also undergoing a difficult time. Back to you.
Right, Namaso, thank you so much for that. Our very own Mac Namaso, they're live from Afya House, where clinical officers and nurses are staging a march. They're actually already there, as you have seen, at Afya House. Remember, this is the second week. The strike by the clinical officers and nurses has today entered its second week. And remember, doctors, if their demands are not met, should be down in their tools on the 21st of December. Unfortunate.